Did you know the signs of diabetes that might appear at night? It's a question that might not cross our mind every single time, but understanding the nocturnal symptom of this common yet serious health problem can significantly make a difference. I am Ofure, a biochemist, and on this channel, we discuss evidence-based information to help you take control of your health. So today in this video, we are going to uncover the 9 nighttime warning symptoms of diabetes you must never ignore. Okay, let's get into it. Starting with number 1, nightmares. Blood sugar fluctuations are a clinical symptoms of diabetes, and evidence has found that more than half of all severe hypoglycemic episodes occur at night. Ideally, when a person's blood sugar level falls below the normal 70 milligrams per deciliter while sleeping, that person is said to have experienced what is called nocturnal hypoglycemia. And when this happens, that will result in a nightmare. It's going to make you to feel sweaty and clammy. But the funny thing is that when you wake up at that moment and you grab a piece of chocolate, when you go back to sleep, that mental symptoms are going to disappear. This is actually a sign of transitioning. It means that your insulin resistance is transitioning into the diabetic state. Alright? Now, number 2 is frequent urination. Do you wake up multiple times a night to urinate? Though there are many reasons why you may be waking up to use the bathroom, like if you have an enlarged prostate or you have an overactive bladder, sometimes that could be a hidden warning signs of diabetes, and here is how. When your blood sugar level is very high, it's not just your pancreas that work extra harder to regulate your blood sugar. Also, your kidney have to work over time to filter excess glucose, which you are going to pass out in your urine. And this can result in increased frequency of urination, most especially at night when your metabolic rate drops due to physical inactivity. So if you find yourself in this situation, waking up multiple times in a night and you don't have overactive bladder or you don't have an enlarged prostate, that could be a sign of diabetes as well. Number 3 is increased taste. Now, I have a personal point to drive this home. In the university, I had a roommate who was diabetic, but he didn't tell us about his condition. Not until I noticed some telling signs. And what were these signs? He would get up multiple times a night to drink water and also to use the bathroom. And in the morning, I would see ants swarming around the toilet, which is a sign of spilled sugar in his urine. And when I asked him, he actually told me that he had diabetes. So this increased test and frequent urination cycle makes sense when you understand that the more you urinate, the more dehydrated you become and the more tasty you feel. So if you notice this sign that you drink water most of the time, most especially at night, that could also be a sign that you have diabetes, and then you actually need to visit your doctor to measure your blood sugar level, to carry out some laboratory measurements. All right. Now, number 4 is rest leg syndrome. Rest leg syndrome is kind of a neurological disorder that causes you to have this sudden urge to move your legs. Now, why this can happen any time of the day, it usually gets worse at night. But what I really want you to understand is that there are a couple of things that can make you to have this problem. There are a couple of chronic issues, but poor glycemic control makes you run a higher risk. So if you are noticing this sign, you have to visit your doctor, and also blood sugar test is warranted. Alright, the number 5 sign that you should be aware of is excessive sweating. Now, one of the ways in which diabetes can affect your body is through nerve damage. And if it happens to be one of the nerves that controls sweating, it's going to turn it on, and it's going to make it much difficult to maintain a steady internal body temperature, causing you to sweat excessively while sleeping. So do you wake up in a pool of sweat at night? That is also an indication of diabetes. Okay, you have to see a doctor. Alright, number 6 is sleep apnea. Sleep apnea is one of the common early signs of diabetes, and in fact, more than half of people with diabetes usually have sleep apnea. And then this usually happens when the muscle located at the back of your throat and tongue become too relaxed, thereby blocking the airway and preventing normal breathing pattern. Okay, now this condition can really be very fatal because it can result in poor oxygen in circulation, which is hypoxemia. Now, people with sleep apnea usually wake up more than 5 times to more than 30 times per hour throughout the night. And even when you wake up, you don't feel rested because you did not get enough quality sleep. So it can really be very fatal. So if you are experiencing this, you wake up multiple times a night, multiple times per hour, that could mean that you have diabetes. Alright, number 7 is retinopathy. Retinopathy is another common early signs of diabetes, and in fact, 1 out of every 3 people with diabetes usually have retinopathy. So essentially, when you have high blood sugar, it can actually cause a temporary change in your vision. You could have blurry vision, distorted vision, difficulty seeing at night. You could also have floater eyes. You're going to have dark spots in your eye. All of these are indication of retinopathy, which is one of the symptoms of diabetes. Number 8 is numbness or tingling in your hands and your feet. Like they are pins and needle. Nerve damage due to high blood sugar can make you to have this sensation, and they are mostly very noticeable at night. Number 9, which is the last thing I want to talk about, is skin changes. Skin changes is one of the early common signs of diabetes. You start developing skin issues that are mostly noticeable at night, like you could have dry skin, you could have skin rashes, okay? You could have an itchy skin, which may end up disrupting your sleep. All of these are indication of diabetes. All right, so if you are experiencing any of these 9 warning signs, make sure to actually visit your doctor, consult with your doctor for proper diagnosis. All right, so guys, if you enjoyed this video and you want to see more of this content, I would really appreciate if you take a moment to subscribe to this channel. Thanks for watching.